Welcome to the Sleep to Dream Analytics Explainer video, where better sleep starts with better understanding.
All right, let's talk about something we all want more of, something we all struggle with at some point, a good night's sleep. But what if I told you that the key to unlocking better sleep might not be in your bedroom, but in your kidneys?
It's a question we've all asked ourselves, right? Lying awake, staring at the ceiling. We usually blame stress, a busy schedule, maybe that extra cup of coffee. But for millions of people, the real culprit is hiding in plain sight.
That's right. There is an incredibly powerful and honestly often overlooked connection between the quality of your sleep and the health of your kidneys. Specifically, a condition that many people are dealing with called chronic kidney disease, or CKD for short. Now, this isn't just a simple case of one thing causing another. Oh no, it's much more complicated than that. Think of it like a dangerous two-way street, a feedback loop, really a vicious cycle. Let's break down exactly how it works. And just to give you a sense of the scale we're talking about, look at this number. As many as 80%, that is a staggering 8 out of every 10 patients on dialysis, report having serious problems with their sleep. That is way, way higher than what you'd see in the general population. It's a huge problem. So let's start with the first direction on this two-way street. How does kidney disease actually wreck your sleep? Well, when your kidneys aren't working right, a whole cascade of things can go wrong. Your body might hold on to too much fluid, you could develop anemia, your electrolytes get all out of whack. Heck, even the dialysis treatment itself can mess with your body's internal clock and temperature. All of this makes getting truly restful sleep feel almost impossible. And here's where that cycle gets really vicious. Because poor sleep isn't just a symptom, it's fuel on the fire. When you're not sleeping well, especially if you have a disorder like sleep apnea, it can spike your blood pressure and cause inflammation throughout your body. And guess what that does? It puts even more strain on your already struggling kidneys, which can actually make the disease progress faster. Okay, so let's get a little more specific. Let's meet the two main culprits that chronic kidney disease tends to unleash, the primary sleep thieves, if you will. We're talking about insomnia and restless leg syndrome.
First up, we have insomnia. You know, most of us probably think we know what this is, but it's not just about taking a long time to doze off. It's about trouble staying asleep, waking up way too early, or just feeling like the sleep you did get was totally useless.
Now, for folks with CKD, the deck is really stacked against them when it comes to insomnia. The sources we looked at point to everything from heightened anxiety about their condition to the physical side effects of dialysis messing up their energy levels and even disruptions to melatonin. That's the hormone that tells your body it's time to sleep. It really is a perfect storm for sleepless nights.
The second sleep thief is restless leg syndrome, or RLS. And if you've never experienced this, it can be hard to imagine. It's this deep, uncomfortable, sometimes painful, and totally overwhelming urge to move your legs. It gets worse when you're resting, exactly when you're trying to fall asleep. For someone with CKD, this can be an absolute torment.
And this chart, wow, it just lays it all out, doesn't it? It shows how common RLS is based on how well the kidneys are working. So look over on the left. For people with pretty healthy kidneys, it's pretty rare, less than 2%. But as kidney function goes down, that number just explodes, shooting up to nearly 24% for those with the most severe kidney disease. The connection is undeniable. Worse kidneys, worse RLS.
All right, now we need to talk about a particularly sneaky and dangerous threat, one that often goes completely unnoticed, and that is sleep apnea. So, obstructive sleep apnea, or OSA, is a condition where your airway literally gets blocked or collapses while you're asleep. This causes you to stop breathing for short periods over and over, sometimes hundreds of times a night. So, what does this have to do with kidneys? Well, the main culprit here is fluid. People with CKD often retain a lot of extra fluid. When you lie down to go to sleep, gravity causes that fluid to shift upwards into your neck and the tissues around your airway. This narrows the passage, making it much more likely to collapse and cause an apnea event.
And here's the really tricky part. You know the classic signs of sleep apnea, like super loud snoring or having a really large neck? Well, those symptoms are actually less common in CKD patients. This means doctors might not even think to check for it, and this very serious condition can go completely undiagnosed and untreated for years.
You might be thinking, okay, so you feel tired. But believe me, this goes way beyond just feeling a little groggy in the morning. The consequences of these sleep disorders, especially for people with kidney disease, are incredibly serious and can even be life-threatening. It's a massive domino effect. Beyond the constant fatigue, we're talking about a huge drop in quality of life. There's a much higher risk of depression and real, measurable problems with memory, with focus, and just your overall ability to think clearly. I mean, just look at this chart. This is about as stark as it gets. It compares the 18-month survival rates for dialysis patients. The difference between those who have restless leg syndrome and those who don't is sobering. The presence of this one sleep disorder is tied to a significantly higher risk of mortality.
So this brings us to the single most important point of this entire conversation. For anyone living with CKD, dealing with sleep problems is not a luxury. It's not about just feeling a little more comfortable. It is an absolutely essential part of managing your health and protecting your future.
Okay, so that's the problem. It's a big one. But the good news is you are not powerless. So how do we fight back? How do we finally break this vicious cycle? Well, there's some really effective ways to do it.
The approach really goes down two main paths. On one side, you have non-medical options that are incredibly powerful. Things like a special kind of therapy called CBTI, which retrains your brain for sleep, and lifestyle changes like exercise. Then, on the other side, you have critical medical treatments, like using a CPAP machine for apnea, specific medications for RLS, or even just adjusting the dialysis schedule.
So, if this is hitting home for you, what can you do starting today? Step 1. Start paying attention. Track your sleep, your symptoms, how you feel during the day. Step 2. Talk to your doctor. Bring it up with your nephrologist and your whole care team. Don't just assume being tired is a normal part of your condition. And Step 3. Be proactive. Ask about the treatment options that might be right for you.
And really, this quote just says it all. When you consider the huge impact sleep has on quality of life, on other health complications, and even on survival, a conversation about sleep is really a conversation about life itself. It's that important.
So we'll leave you with this final thought. We track all these other numbers, right? Our blood pressure, our weight. We think of them as vital signs. Well, sleep is a vital sign too. So the question is, are you listening to what your sleep is trying to tell you about your health? Thanks for tuning in.
Thank you for watching the Sleep to Dream Analytics Explainer video. We hope you sleep well and dream easy.